A cough can be very annoying and sometimes very uncomfortable. A cough is the most common reason for visiting a primary care physician in the United States. Thoracic surgeon and best-selling author Dr. Eric Presser tells us the possible reasons for a cough and when someone should get it medically evaluated.
Many different things can cause a cough. The most common would be the common cold. And usually when we talk about cough, we talk about acute, which means it's about 3 weeks or less, subacute, 3 to 8 weeks, and then chronic, which is after 2 months of having a cough that just doesn't go away. So most of the time, the cough that we get is from something that comes and goes. Common cold, seasonal allergies, your lungs are irritated by the pollutants in the air, being around people who smoke, starting to smoke, starting to vape. Anything that can irritate the lungs and the airways can cause a cough. When we talk about the cough that stays, or lingers, if you will, that's when we should start to be concerned. That's when we should start to be proactive. Let's try to figure out why we have that chronic cough. Now, most of the time, the chronic cough is caused by acid reflux, and you need a good workup to make sure that you are not regurgitating acid into your system, if you will, that's causing irritation, causing you to cough. There are also types of medications, like ACE inhibitors. But if you're on an ACE inhibitor, about 10 to 20% of patients that take ACE inhibitors can develop a cough. That's a lot. So when you're dealing with cough, you have to first try to identify the cause. Now, the problem with lung cancer is that you can only identify the cause usually when you've coughed up blood or you have a cough that doesn't go away. And that's when you really need to probe a little further, maybe insist on getting a chest x-ray from your primary care physician, or if you go into the emergency room, they might do a CAT scan of your chest. And that's where the lung cancer screening aspect that I mentioned in my book, The Empowering Guide to Lung Cancer, comes in. When I first started writing my book, lung cancer screening wasn't even part of our society. Now, if you're between the ages of 55 and 79, and you smoked a pack of cigarettes a day for 30 years, or 2 packs a day for 15 years, you should get a screening low-dose CAT scan of your chest, and that is as per Medicare guidelines. So because these are now national guidelines, they are covered not just by Medicare, but all insurance companies. The bottom line is, if you do have a cough that doesn't go away, don't ignore it. It's better to know than to not know.